Welcome and good afternoon to everybody. I'm delighted to be moderating this session on a topic that really affects all of us, one way or another. My name is Mina Al-Arabi. I am the editor-in-chief of The National, based here in the UAE, so also welcome to the UAE. It's a delight to have those of you here at the annual meetings of the Global Future Councils with us in the room, and also for those who are watching the live stream on the World Economic Forum and The National, thank you for tuning in. Our session is entitled, What is the Cost of Underinvesting in Health? For every $1 invested in health, it yields up to $4 in economic reform. The World Bank says ensuring that every person has access to health care is fundamental to ending poverty, increasing productivity, and building robust economies. And I'm sure we could spend hours speaking to the virtues and the importance of investing in health. However, we know that budgets and economies are under strain, and yet there is also incredible innovation that is being developed. And there are public-private partnerships that are also being developed that give us hope in terms of not only investments in health, but also coming up with solutions for healthcare. We have an incredible panel here. We are going to be opening up for questions. So very soon after our initial conversation, we'll be inviting you to pose your questions to our panel. So I would like to introduce them. Her Excellency Maha Barakat, Assistant Minister of Health and Life Sciences here at the UAE. Amit Buri, who is CEO of Global Impact Investing Network. Alison Holmes, Professor of Infectious Diseases and Director of the Fleming Initiative at Imperial College London, and Damiano De Felice, who is the Chief External Affairs Officer for CarbX. Very nice to have you all here. Dr. Maha, if I can start with you, please. We talk about the costs of underinvesting in health. If you can start us off with an assessment of the risks that are facing healthcare on a global level at the moment.
Thank you, Mina. So the risks around the world can be summarized in about probably 6 wide categories. And these change from year to year, but more or less, I can perhaps summarize them in 6 categories. The first one is climate change, and this will come as no surprise to most people. The Intergovernmental Body on Panel on Climate Change has estimated that if the high emissions scenario continues, about 9 million people will die every year by the end of the century. I mean, that's even more than the number of people who died in COVID-19 over 3 years. So it's a substantial and significant impact to global health. And the economic cost of that is about $2 to $4 billion every year by 2030. So I think climate change is front and central of all discussions regarding challenges to health. Perhaps slightly related to it, but it could be regarded as an independent category, is emerging disease, new viruses and new diseases that jump from animals to humans, and antimicrobial resistance, the topic of much of the conference of this event of the last in these 3 days. And if you allow me, Mina, I'm going to, we'll defer the discussions on antimicrobial resistance and emerging disease to Professor Holmes. Then comes the big category that causes 3/4 of deaths around the world, non-communicable diseases. So that's a big bag of diabetes, heart disease, cancer, strokes, dementia. All of this is categorized as non-communicable disease, and these cause 3/4 of the deaths worldwide. Just over 40 million people die from non-communicable diseases. The next category would be communicable diseases other than the ones I've already mentioned for emerging disease. Around the world, tuberculosis, biggest killer. 1.25 million people die every year from tuberculosis. And this is an increasing challenge with antimicrobial resistance. What we thought worked is now not working very well. And there are strains of tuberculosis that don't seem to respond to any antibiotics. That's tuberculosis, there's polio. And we can talk about polio again, but polio is special because we're in the last mile and the most difficult mile of getting rid of this awful disease, period, from the world. The last time we got rid of a disease forever was smallpox in 1980. So smallpox was the first disease ever to be eradicated from the world. And thank goodness, because it caused so much disease, so many deaths. And we're glad to get rid of it. I hope the next one will be polio. Perhaps a close contender is guinea worm, but we're very close. There's also malaria. Malaria is something that affects millions of people. Over 200 million people around the world every year get malaria, and over 500,000 die, most of whom are children and pregnant women. So when we talk about investment per dollar, return on a dollar, that's an average 1 to 4. But you see, when a disease kills the young, the investment in preventing that disease is far more than $4 for every one. It's far more valuable to rescue a child. And then the last category isn't one that I normally would include, but I think increasingly we have to take into consideration, I would say, malicious attacks on the health sector. Intentionally, like cyber attacks and synthetic drugs, and unintentionally, like misinformation and disinformation. So this is a new category that we don't normally consider as a global health challenge, but I think increasingly we have to include it. So these are my thoughts to begin with. Thank you, Mina.
Thank you. And the ability to meet those risks and those challenges that are becoming more complex as our world gets smaller, but also as we saw not only during COVID-19, but during, even trying to eradicate polio. One political event somewhere can happen that can derail, or you have an outbreak somewhere in a particular part of the world that affects all of us. So Professor Holmes, if I can come to you next, what do you see as the greatest challenge in meeting these risks, especially if we're putting it in the context of our meeting here at the World Economic Forum and in terms of cooperation to meet those challenges?
Certainly. So climate change has been discussed, huge amount of global awareness and engagement with the young around climate change. We need to be able to do that around addressing the challenge of antimicrobial resistance. It's a threat to our healthcare now, and it's a threat to our healthcare in the future. Our healthcare completely depends on it. So the non-communicable diseases that Maha was describing completely depend on being able to have effective antibiotics and be able to access them. So I would say one of the major challenges is the awareness about that, and that we all need to be advocates of that, and the young need to understand that we all have to be involved in saving them. And it's a natural phenomenon, and that we absolutely cannot depend on the drugs to do everything. And we need to think about the strategies to maintain healthcare and make sure it's equitable. And remember that prevention is a key aspect of it, whether that is water and sanitation, whether it's infection prevention in our healthcare. I mean, over 1 in 5 of the prescriptions for antibiotics in hospitals are for infections acquired within them, or whether it's vaccination. So it's really, really important that we focus and invest in preventing infections so that we can minimize the drivers of antibiotic resistance. And that's for everybody around the world. That's for healthcare resilience. We can save the planet from climate, but we will have climate change, but we'll have no healthcare for us unless we treat this the same way and engage and make sure that there's awareness. And if we can use this meeting in Dubai to promote that and across the other global future councils, that will be a major achievement here and now for the next couple of days.
I just want to very quickly follow up with you. I mean, as you said, you need a whole effort. Yep. So there is the education, there's investment. If we're talking about the cost of investment, yep, often you have to convince people that this is a priority when there are so many other competing priorities. How do you do that?
I'm going to ask Damiano to give us some examples of that. But I think awareness has to come first. And the other thing is, I think we need to listen to personal stories as well. So it's really important that we don't talk about this just as a kind of health systems level or societal level, which it is, but actually listen to the personal stories. So what do we have to thank in terms of what antibiotics have done for us personally, for our loved ones, for our family, and actually get that kind of visceral engagement about why they are critically important, and then move on to how we can invest. Damiano, tell us how to do it.
There are multiple things that can be done. I think that the title of the panel is about the cost of underinvesting. I would challenge that in terms of, it's usually in a company or for an investment firm, either something is a cost or is an investment. And it's important that we start looking at health as an investment rather than as a cost. We're going through a significant shift in international funding, and the money coming from international actors, from domestic actors, will change significantly in the coming years. But one thing will remain central, which is the importance of the private sector, of incentivizing the private sector to continue investing in health. We will have other speakers as well who will speak about impact investing as an important topic. It will be important to include also big asset managers and insurance companies to understand their responsibility to invest in this space, also as a substrate, as a basis for other investments that they make in other sectors of the economy.
And so that idea of private sector investment rather than just always relying on governments and seeing what governments will do. But they also have to look at, the private sector also has to look at their bottom line. They have to think about returns. So I agree with you to look at health as an investment not a cost, but at the end of the day, how can you convince them of the return if the return often is indirect?
The reality is that the main question is about the short-termism of some companies and some investments with respect to the long-termism of the results and the impact of this. So a key element, I think, from the public side is to ensure that there is a better alignment between the short-term cost and the long-term returns on the investment. And there are multiple ways where, public sectors, actors, international financial institutions can implement activities and policies fundamentally to provide a backstop fundamentally for private investors to invest in space.
How do you approach it? You're, again, very much about impact investing and creating that network for investors. How do you see it?
Sure. First, thank you for having me here. And I'll just give a brief definition of impact investing so you know how it fits into the broader conversation on private sector activity and investment. But impact investments are investments that are made with the intention of generating a positive, measurable social or environmental impact alongside a financial return. So this can be done across many sectors: housing, food and agriculture, and of course health. And one of the things that I think is so important in this moment is for us to really rethink about how we want to provide for a healthy world and how we want to provide for healthy societies. Damiano spoke about kind of declining kind of government support in some areas, and McKinsey's recently come out with an estimate that overseas development assistance for health is expected to decrease by 44% from 2022 levels. So there's a lot less money flowing in the form of aid around health, but of course we still need people to be healthy, and we need. And so one of the opportunities and the needs is for greater impact investment in health. Governments will continue to play an important role, so will aid, so will kind of. But one of the things that we see is great opportunities that investors who care about the positive impact and are prioritizing it can play a greater role in helping to improve health outcomes. So currently, based on our global data, about 54% of impact investors have at least one investment in healthcare, and about the same percentage plan on increasing their allocations over the next 5 years. But we could still use a lot more impact investment in health. And just to be explicit about a couple of the ways in which impact investing can fit into the broader system, because I think your point is right. Obviously, governments play a critical role in providing for health systems. Not everything is investable in a functioning health system, but there's certain areas that are. So we've seen a lot of activity amongst impact investors focused on increasing access to medicines, to critical supplies, to diagnostics, and important materials that are used by the health system. We've also seen a great emphasis on increasing the availability of data to inform health policymakers and decision makers. So through the use of providing health services, using technologies, a lot more data that can be captured, and some impact investors are investing in those components of the system. And last but not least, there's addressing financial barriers. So whether it's investing in kind of more streamlined delivery systems, helping to invest in insurance, availability or helping to address even in financing mechanisms. There's opportunities for impact investors to play several roles across that range to help improve health outcomes.
Dr. Mahat, the UAE is not one of those countries that's actually pulling back from investing in health or, frankly, foreign direct assistance abroad. But how do those decisions in terms of priorities come about? And what is the UAE's position at a time that we are seeing a changing landscape when it comes to investing in health?
Thank you. So what does it mean investing in health? And I think there are two underlying principles for the UAE. One is a healthy population is a prosperous one. So you need, with health, you have happiness and you have prosperity, you have economic up boosts. And so so it's really important to invest in health, both locally and internationally. I can briefly talk about those. And secondly, the value of human life. No one should die of a preventable disease, not least children. So I think with these two principles, I think it explains the UAE's perspective on investing in health. On the international global level, there's a very strong humanitarian program from the UAE that has really started from the 70s with the late Sheikh Zayed. And even in the 70s, when before even petrol was found, oil was found in the UAE, you find His Highness, may God rest his soul, Sheikh Zayed, funded water sanitation programs in Africa and some of the poorest parts in the world. If you go around the world, you can find in a small village that perhaps not many people know about, with a well or a water or a school with the name Zayed on it. And this all really started from the 70s. In the 90s, Sheikh Zayed met Jimmy Carter and got to know about his amazing humanitarian work with trying to eradicate guinea worm with the Carter Center. And that really started Sheikh Zayed's support of trying to eliminate and eradicate guinea worm. And with that came polio and malaria and other neglected diseases. So from an international level, the UAE has for many years supported investments and humanitarian aid, be it through vaccination programs, UNICEF, WHO, Gavi. Millions of vaccines around the world have been funded by the United Arab Emirates. In natural disasters, whether they be typhoons or floods or earthquakes, the UAE deploys assistance and humanitarian aid. In conflict areas like Gaza, I think the latest estimate was $828 million have been spent by the UAE in humanitarian aid for Gaza. You have field hospitals in other areas and conflict areas, and you have other types of medical assistance. So from the international level, trying to help the world and investing in trying to strengthen health systems and eliminate and eradicate diseases is really a main agenda for the UAE. And then domestically, we lead by example. So the UAE has invested heavily in what it thinks are the emerging technologies, over and above the usual ones, over and above universal health coverage and programs for antimicrobial resistance and looking at ways of preventing and treating non-communicable disease, but advancing the field. So what is the UAE now doing to try and help the health sector? They're investing in artificial intelligence. I think that artificial intelligence will be the game changer in the 21st century. I used to think it was going to be gene therapy or stem cell therapy that will be the real breakthrough of the 21st century. But I actually believe now it's artificial intelligence that will facilitate all the others. So once you crack artificial intelligence in health, I think it will open up all the other doors.
Do the other panelists agree? Is AI the big game changer 21st century?
So
I'm going to let you continue your thought, but I just wanted to, on this.
AI, we really need to embrace it and use it appropriately and share data and be able to provide data that will inform individual management and also extraordinary public health advances.
Please carry on.
I'm very pleased that there's kind of increased discussion on this, and I think perhaps Professor Holmes will agree that the breakthrough of the 20th century was perhaps vaccination. In the same, not antibiotics and not, but perhaps vaccination was the breakthrough of the 20th century, and maybe artificial intelligence will be what will become the breakthrough of the 21st. And that will facilitate other things. So we've already started an Emirati genome program to help with personalized medicine. We've got the Abu Dhabi Stem Cell Center for regenerative, to try and regenerate and treat degenerative diseases. And we've set up a newly formed Emirates Drugs establishment to fast-track drug development and research into newer treatments for disease. So I think this is a kind of our perspective on where the priorities are.
But I want to just for a moment spend a moment on polio, because I think, as you said, to have that so close, it's the last mile, and yet we are still having a challenge, particularly in Afghanistan, Pakistan. There were some reports that potentially in Gaza you've had a few cases. Iraq had a couple of cases during ISIS when they couldn't go about vaccinations, and hopefully that largely seems to be under control. The cost of underinvesting now in ending polio as a disease, what would be the cost?
So polio is a virus, and it plagued the world for decades and centuries. And way up until, let's say up until 1988, there were something like 380,000 cases of polio. Now, today, so far, the 2025 statistics, I've just been updated. There are only 36 cases in the world, 27 in Pakistan and 29 in Pakistan and 7 in Afghanistan. So the world has made enormous progress over the last few decades. But it's not enough. And the reason why I'm saying it's not enough, we are in what's called the last mile, and it's the most difficult mile. Because if we suddenly stop all our efforts to get rid of these last 36 cases, the numbers will mushroom exponentially. And very soon we'll be back to hundreds of thousands of cases of polio, not just in those two countries, but in every country around the world. The virus, just for everyone's knowledge, the virus is detected in many, many countries in every continent. So if somebody who has not taken a vaccine comes across the virus either in sewage or in dirty water or somewhere that hasn't been properly cleaned or sanitized, they will develop polio. This is really what we're talking about, and this is why we have to continue with the vaccination program, we have to continue with the education programs, and we really have to finish the job. And if we stop or just reduce our efforts now, it will bode very badly for trying to eradicate this terrible disease once and for all.
So to expand on that a little bit more, so firstly, from a personal perspective, polio, it's not that long ago, my father's sister died related to polio just before I was born. This is real. So and in terms of what we're trying to do here, in terms of raising awareness around antimicrobial resistance, we want to flag that the power of vaccinations and the power of prevention means that we will be minimizing the unnecessary use and the potentially unnecessary prescribing of antimicrobials. So any misinformation or lack of trust around vaccination, it's critical that we address that. And just to talk about, we will not be able to provide the healthcare, even if we have the most fabulous AI, if we cannot prevent infections and if we have no access to effective antimicrobials. So the phenomenal advances in immunotherapy or robotic surgery or amazing advances in oncology and transplantation, we will not be able to realize them if we've got no effective antimicrobials to look after people to either prevent infections or address the ones that they acquire. So looking at this at a kind of whole systems way in terms of preventing, using antibiotics wisely, and making sure society is on board with that, and furthermore, that investors are on board with that to understand the critical implications it has.
Yeah, I think what is often forgotten is that pathogens like bacteria and viruses take advantage of a fundamental element of the human being, which is the fact that we're social animals and we like to be together in this room speaking with each other. And I think both vaccines and antibiotics have been turbocharger of economic development in the last century because they allowed people to be together, to spend a lot of time together, and to travel from one place to the other without the risk of infecting all of each other. And this is pretty amazing if you think about it, because all the lack of trust that we're now putting into the system with respect to vaccines, the lack of incentives to develop new antibiotics, is putting us fundamentally at the risk of not being able to have all these type of meetings, all these type of interactions, because of the bacteria, the pathogens, the viruses taking advantage of something that will always stay. Whatever AI we will develop, hopefully we will still have human social interactions where bacteria, viruses will try to take advantage of that.
When you think about this particular element of both the lack of awareness and this hesitance for vaccines in certain parts of the world, I have to say, in our part of the world, Middle East, North Africa, it's more a case of access to health for places that are, less privileged than other parts of the world. That's the biggest concern. But we don't really have this political issue around vaccines. When you think of it from your vantage point of impact investing, how much is raising awareness or pushing back against, rolling back what we've been able to achieve in other parts of the world when it comes to vaccines?
Yeah, when it comes to something like vaccines from an impact investor's perspective, a lot of the issues are similar to what you raised around access. Yeah, so typically, like, how do we actually make sure that vaccines and other medicines, the things that have been developed, are accessible to everyone? So a lot of the impact investment activities could be anything from the production, of certain types of medicines. In some cases, we have need production in various countries that typically haven't had that. So it requires investment in capacity, to the distribution. And of course, if there's ways in which those processes can be streamlined around the delivery, and addressing financial barriers if those exist. So that's typically how impact investors would really think about it. A lot of it's around access to health and access to health services. Certainly, these questions around like narrative and communications are important. That typically is less where impact investors would kind of be equipped to lean in, and is much more reliant on health officials, kind of media, et cetera. Totally important, but not kind of the explicit contribution of impact investors.
Okay, I want to open the floor to questions. So please indicate to me if you have a question. We'll get a mic to you. Okay, so we'll start over here, please. And if you can kindly identify yourself before asking your question.
Thank you. My name is Catherine Garrett-Cox, and I'm here representing Gulf International Bank. So I come from the finance sector. And I guess my question to the panel, thank you, Mina, for leading this, is if the exam question is, this sector is underfunded. As I look at many similar issues where we've been trying to mainstream the conversation beyond the impact investing community, you have to put a price on it. We've seen attempts to price carbon. We've seen attempts to price water. We've seen increasing attempts to price biodiversity. So I guess my question is, what would it take to put a price on human health to mainstream this topic?
Okay, great question. Damiano, do you want to take a stab, and then I'll come to you, Amit, for it?
We do put a price on certain elements of the health sector. So when a new medicine comes to the market, for example, there are certain governments that do something which is called a health technology assessment, where they fundamentally put a price tag about what is the value of certain improvements in the life of people. And this is the basis of negotiation between the public sector and the private sector in terms of what is the value of the new medicine or the new technology that they bring. I still think that a key element here will be to provide also not only the cost but also the return of investment. So there are obviously the two elements which are relevant here. For what we know in antimicrobial resistance, and what the community has been working a lot, I think, in the past few years was very much to put this price tag on what it takes to develop new antibiotics, bring them to people, and what is the return of investment. There has been research done by the World Bank and by the OECD. A recent report from the Center for Global Development told us that the investment in new antibiotics and providing access has a return of investment of 28 to 1. And it costs roughly like 60 billion. So this leads to obviously important savings, important productivity gains. Like in the long run, by 2050, it's expected that fundamentally the economy will be 1 trillion bigger if we make this investment. So I think that obviously each of us is working a little bit in silos, but putting all these things together will be pretty important, I think, for governments to understand the value of investing in the space.
So we do a lot of work in this area, but particularly with an orientation around kind of how investors would think about performance. We really emphasize things along two dimensions. Of course, there's the financial dimension, which I think is quite well known to investors and very conventional. But the additional component that we think about is the kind of the impact performance. So we support a system called IRIS Plus, which is a free public good. It's a measurement system focused on outputs and outcomes. Organized by sector, and health being one of those. And it includes many of the kind of dimensions that I shared earlier around increasing access and addressing financial barriers. However, it'll have a set of metrics, results that investors can measure. And I think what you're speaking to is going a step beyond that. And we have not been of the view that we should try to like convert everything to a financial price. And so we haven't done work in that area explicitly. But where we have made some headway, even just in the last few months, that I think has a lot of potential. We've set up something called the Impact Lab, where we're looking at new ways of quantifying and analyzing impact performance. And we've actually been testing out with investors something that's well known to academics, which is quality adjusted life years, as a way of distilling various types of health impacts, but also it could be everything from providing housing or addressing air pollution or other things down to a kind of a single metric that people can use that's very relatable. We've only kind of put out some thought leadership on this ourselves in the last few months, but it's actually getting a surprising amount of traction. It's kind of interesting that a lot of, I think, investors are now thinking about this fundamental dimension of like, how do we actually improve humans' lives and livelihoods? And are the ways that we can take all the complexity of all the issues that people in this room are thinking about online and actually distill this down in some ways that are just easier for people to get their heads around. And I hope that will actually help motivate more focus on how do we actually take all the resources in the world and all these needs and channel them towards actually improving the way people live. So thanks.
Thank you. There's a question.
Hi, thank you. I'm Zane, Latvian Education Accelerator, and I wanted to ask a question about mental health challenges, and in particular in the context of Gen Z or anxious generation. So we work a lot with both Gen Z, but also with employers, and we see how it dramatically affects also productivity levels and sick leave numbers, and employers are doing their best to invest in different kind of wellness programs and so forth, but it's not enough. So where do you see that direction going, and are there any breakthroughs or any innovations somewhere at the frontier, or
Maybe we can share the response with Prof. Holmes, but I think by Gen Z, so the youth, I think the question is about the youth, and they have never been more important. So we saw this in climate change, and we're seeing now in several other topics with activism from the youth. They will make the difference. The youth have a very loud voice. They are inheriting the world we are preparing. And therefore, we have to listen to them. And perhaps I'll hand over to Professor Holmes, because I think it's a really important topic, actually.
So I was letting Maha get on with that, because I thought your question was about about learning from the work done around mental health. So there's an enormous amount to learn from that work. But I'm not going to talk about that, but I recognize it's a huge amount that can be learned from the work that's being done around mental health, and how much that means to the younger generation as well, and how in tune they are. But I would like to say a little bit about education and looking to the future. So the Fleming Initiative has just embarked on a piece of work with global leaders in education about making sure that the knowledge and the understanding of like climate change is embedded in primary and secondary school education, which actually was an action from the UN General Assembly report, that was a major gap, a kind of lack of understanding and awareness, and how to make both formal education in terms of embedding in curricula, and then more informal ways of working with the youth in terms of appropriate communications. And there's such phenomenal work going on. And examples from around the world, whether it's Nigeria or Sri Lanka, about what's being done in terms of youth engagement and what works within education. So that's a really important piece of work. But I'm sorry, I'm not adequately addressing the mental health side, but there's an enormous amount to learn from that work.
Okay. Amit, you.
Yeah, just very briefly, much of the work in impact investing has been focused on other types of health and health access, but we have actually heard from a few impact investors recently of launching strategies and exploring ways that they can invest in the increased provision of mental health services. So I do think there's some innovation. I'm not a particular expert on this yet, but it's been bubbling up, which I think is promising for the future. Thank you.
Hi everyone, Zubaida Bai with the Grameen Foundation. My question is more around how much are we thinking about health more holistically? I was a part of an advisory committee where we looked at social determinants of health in terms of housing, longevity, access to AI. How does AI integrate climate, childcare, the burden of care economy? When it comes to investment, especially, Mr. Bori, how are we measuring our interventions in social determinants of health directly impacting healthcare?
Yeah, no, thank you for the question. It's actually something I was hoping would come up because I think because I do think it's very important. And one of the ways that we're increasingly seeing like impact investors start to think about things, the early days, people were very kind of single issue focused, understandably, but I think there's an increased recognition that you have to think more holistically about this. And so, for example, with health, we have impact investors who are thinking about provision of shelter, like affordable housing and all the health outcomes that come from that. Certainly things like water and sanitation is an emerging area for impact investors. A lot of activity around food and agriculture. Of course, some people think about it from a climate standpoint and sustainability, but increasingly around nutrition and how to make sure people just get fed properly all around the world, which is a huge issue, as I'm sure you know. So I do think there's a movement more towards thinking about the integration and intersection of various issues. And I think for health, it's essential because you could, of course, get great access to medicine, but if you don't have access to nutrition and clean water, you may not result in the health outcomes that everyone is seeking. But thank you for the point.
Thank you. And our last question here, because I know we're running out of time here, please. Yes.
Okay, thank you very much. I run a medical credit fund, which is the first impact fund in Africa. And what I'm finding is that it's extremely difficult to lend because of the risk. If you want to make impact, it's usually at the bottom, of the pyramid in Africa, those who are not covered. So what I'm trying to figure out is, from your experience, how have you been able to mitigate? I don't know if you've invested in other markets where it's risky. How do you mitigate that? Because I'm sitting on 40 million euros that I can't lend, and yet people are not able to access healthcare.
No, thank you for the question. And it's actually part of the topic that my council here is addressing, the Global Future Council. And so we, just to be clear about where we sit, so we represent a network of investors. So it's about 450 members in 60 countries. Many of whom are also contending with risk, and in an environment right now where risk is increasing, both some of the real risks and also the perception of risk. So this is a very topical issue. I think one of the big issues we need to kind of address as we think about the future of international development and aid is actually how we kind of reduce the risk. Of course, we have to reduce perceived risk, but also the real risk inherent. And I think increasingly, we need to be more effective at using models of blended finance and other types of mechanisms that kind of help reduce risk in the system. So I'd be happy to talk to you about it further afterwards. Yeah, thank you for the question.
Thank you. Okay, so I've left the last question for myself, where I'm going to ask each of our panelists the same question, which is for the people here in the room, but also those who will watch us, to think about what is one issue from the work that you're working on that you want us to think about and advocate for that could make the greatest impact in having better health outcomes. So it's a big question, but really I want you to zero in on one issue that you think we should be advocating for and work towards to have better health outcomes. So Damian, I'm going to start with you.
I think for me it would be changing the way in which we think about health, which is not only a cost but also an investment in critical infrastructure. I mean, we build roads and bridges and airports so that people can be more productive. These things are useless if people are sick and cannot work. And so I think it's critical that we start looking at health as a key element for the infrastructure of our society.
So I would say to realize the role of how we use antibiotics and how we prevent infections. It's how our healthcare depends on it, our individual lives, our families' lives, our society's lives, and their health depends on access to them as well as them being effective. So I'd like us all to be advocates of that as individuals and as members of organizations and societies and people of influence.
Yeah. I would just say that if we want kind of healthier people and healthier communities and societies, we really need to make sure we're investing more in health. And I'd hope that governments, as they take this moment of change in the world and disruption, could really lean into thinking about how we can mobilize more investment in health from other sources.
I think most of what can be said has been said. Probably what's left as a priority, as we use more and more artificial intelligence, I would lobby for responsible use of artificial intelligence and somehow trying to contain and restrict misinformation and disinformation, because the artificial intelligence will only be as good as the information you put into it. So, this is just a caveat for how artificial intelligence will be used for the rest of the century.
And it's incredible how it can be, as you said, a game-changing tool, but can also be game-changing in terms of the misinformation and actually skewing people's perceptions and actions. Thank you very much to my incredible panel. We could have taken this conversation in so many different directions. The challenge here was deciding what to talk about because there's so much more we can learn from them. So do grab them the next day and a half that they're here at the annual meetings of the Global Future Councils. And thank you to the World Economic Forum for facilitating such an interesting conversation. Thank you all. Please thank our panel.